News Day continues here on One News Now. I'm Riza Diaz. The World Health Organization has declared a new coronavirus variant to be of concern and named it Omicron. The Philippine government has temporarily suspended inbound flights from several countries to prevent its entry. Let's talk more about this with Health Secretary Francisco Duque III. He's joining us over the phone this afternoon. Secretary, good afternoon.
Hi, good afternoon, Rita, and all your viewers.
Secretary, what do we know so far about this new variant? And can we actually say that it's actually going to be worse, or is it worse than the Delta variant?
Oh, we don't have enough data to say that it's worse than the Delta variant because they're still trying to characterize further the features of this Omicron or the B1.1.1.529. Okay, so it's now the Greek nomenclature that's being used is Omicron. So what they know is there's seems to be a lot of mutations in the spike protein. Okay, and whether these mutations that has brought about this Omicron variant will affect the following. Number one, is it going to be, it looks like it's more transmissible, okay? But how much more transmissible is it? It's not very clear. Now, is it more virulent? That they're still trying to find out. Is it capable of an immune response, meaning it can escape the protection that the vaccines provided in the human body? So they're looking at all of this. Is this going to have more severe clinical outcome? Is it going to be more serious? Is the antibody being produced going to be as effective in terms of the immune response to the vaccines? So a lot of this will have to be further studied and characterized.
Secretary, we know so far that we've already suspended several flights, rather, to prevent its entry to the country. But what is the government's next steps after this travel ban that we have imposed? Should the public expect perhaps the restrictions to be tight again?
No. What we need to do is the more disciplined compliance with the minimum public health standards. So, whether it's an alpha, beta, delta, kappa, or Omicron variants. So, it has been proven time and again that the minimum public health standards are effective. So, wearing of the mask, hand hygiene, use of sanitizers or disinfectants, physical distancing, and other social measures. In fact, even face shields in the closed spaces, crowded areas, as well as in close contact settings. Maybe of additional protection. So all of these we need to do, and we've been doing this, in fact. So we just have to be more disciplined in terms of compliance.
Sir, Hong Kong has already recorded at least 2 cases of the variant. Do we have any plans, perhaps, the government, including Hong Kong in its travel ban?
Yeah, we're waiting today whether of course, Hong Kong, they've already identified Belgium, Israel, Botswana. So there should be an additional number of countries that will be included in our travel ban. But we are waiting for our experts to give us a more definitive recommendation. And that's going to happen between now and about 6 o'clock tonight.
Secretary, we certainly hope that it doesn't get, to a level that it's going to be overwhelming again for our hospitals. But should it happen, is our healthcare system ready for another surge?
Well, it's going to be difficult, I'll tell you, because, we have just had a surge or spikes in September. We had the peak number of cases in September. So, barely 2 months, no? if hopefully this does not bring about another spike over the short term. We are looking at and hoping that if there's going to be a spike, which is a possibility, as you can see in Western Europe, even if their vaccination coverage is relatively high at 80%, we see that they are experiencing their fourth wave, and that may very well happen to us. So we need to be careful. We need to really comply with the minimum public health standards, other public health and social measures, and of course, the vaccination is one of the key solutions to responding to the COVID-19 pandemic, whatever the variants. No? So we're still awaiting the WHO further advisory. They are meeting. I think they met yesterday. This is the Technical Advisory Group on Virus Evolution.
Sir, given you mentioned vaccination and given the increased mobility, even for the younger ones, do you think or would you recommend now that perhaps is a time to roll out boosters for the general population and again shots for the younger ones?
Well, the booster, what is more effective is to give the first dose to the people who have not even received any drop of vaccine. No? So that is the more important strategy, more than the booster dose. It has already been shown that if you provide the first and the second dose of the primary series to individuals who never had the vaccines, the population protection is going to be a lot more effective.
So we'd also like to get your insight, Secretary, because the concerned doctors of the Philippines wants other treatments such as ivermectin to be considered. What are your thoughts on this?
Well, they have been pushing for that, and we are just we continue to listen to them and to the new developments or findings, and so far there seems to be no clear or definitive indication that this is effective for COVID infection. It's good for parasitic infection, but for COVID, there is really a conflict of findings or data. So one side would say it is effective, the other side it's not. So let me just say also that the fact that we were able to bring down our cases quite substantially over the last 2-3 weeks, even if we didn't give ivermectin throughout and to all these people, we see a continuing decline of our COVID cases. In fact, in NCR, we're only below 300 now, no? Which is really never seen before. So, they cannot say that this is because of ivermectin, because I don't think many people took ivermectin, only very few. What we know is that NCR has had 94% completed vaccination coverage, and that also has helped a great deal in bringing down the number of cases.
Secretary, one final question. Since the National Vaccination Day will be, or days rather, will be held from November 29 until December 1st, do we have enough supply of, let's say, jabs and syringes for this?
Well, the supply of vaccines, no problem. It seems our problem will be the syringes, no? Because the syringes we ordered from UNICEF did not arrive on time. So we might need to recalibrate our targets, and we might have to do another round of this massive vaccination rollout sometime in the middle of December.
All right. We'd like to thank you for for sharing with us your thoughts and your insights and those information. That's Secretary Francisco Duque III of the Health Department. Thank you, sir.
Okay. Thank you very much, Rita, and to your viewers. Keep safe.
Maraming salamat, sir. Meanwhile, the Health Department logs over 800 fresh COVID-19 infections today. Now, this brings the total caseload to 2.83 million, 17,000 of which are still active. At least 7 duplicates were removed from the case count. Now, 188 more people died of the virus, pushing the nationwide death toll to more than 48,200. 156 of which were just reclassified from recoveries after validation. Survivors, meanwhile, are now at 2.76 million, with over 1,600 new recoveries logged today. 2.4% of some 37,200 people recently tested for COVID-19 turned out positive. Presidential aspirant and Manila Mayor Isko Moreno assures his critics that his local government is still handling COVID-19 crisis properly, while he is making political rounds in various parts of the country. JC Cosico with a story.
Aksyon Demokratiko standard-bearer and Manila Mayor Isko Moreno visited the San Pablo City Public Market in Laguna on Saturday. There, he bought food and even ate sagobi or ginataang bilo-bilo in an eatery. He exchanged handshakes and took selfies with people, apparently disregarding the physical distancing protocol. The COMELEC earlier banned these during the campaign period for the 2022 elections.
Nag-iingat naman kami. At saka kinakargaan ko ng maraming dasal. Ang gusto ko, makasalamuha ang tao. Pero sir, with all honesty. But it's scary in a way, technically. But that's the price we have to pay.
Some critics are questioning his listening tours as he remains to be the mayor of Manila. In response, Dumagoso assured them that his city is still on track, including its COVID-19 response.
Kamusta naman ba Maynila? Basta masaya ako, ako na may panatag. Kayang-kaya ni Vice Mayor Hanin Lacuna. Yesterday is our lowest COVID case since last year. Kahapon 10 lang.
During a town hall meeting with multi-sectoral groups in San Pablo, a resident said Dumagoso's visit convinced her to support the presidential aspirant.
Ang gusto ko si Lenny. Pero nung mapakinggan ko lahat ng sinabi mo, ikaw na.
Salamat sa Diyos. I hope marami pang ganun. Kaya gustong-gusto namin makipag-usap mismo sa tao.
When asked if he's threatened after 4 major political parties, namely Partido Federal ng Pilipinas, Lakas Christian Muslim Democrats, Hugpong ng Pagbabago and Puwersa ng Masang Pilipino joined forces to support the Marcos Duterte tandem, Dumagoso had this to say.
Kami aksyon demokratiko Dire-diretso lang kami, focus lang kami sa tao. Yes, sir. Hindi rin naman kami ang makakapag-desisyon on their behalf. I wish them good luck.
Dumagoso, together with his running mate Dr. Willie Ong and senatorial aspirants Carl Balita, Jopet Sison and Samira Gutok, also went to Quezon Province. For News 5, JC Cosico, we are One News.
Now, here are other developments in Philippine politics. Presidential aspirant and Senator Manny Pacquiao is currently in the Caraga region to visit his supporters. He recently arrived in Siargao to give financial aid and other assistance to residents. The League of Municipalities of the Philippines Cebu chapter claims that all 44 mayors in the province have endorsed the Marcos Duterte ticket ahead of the 2022 elections. LMP Cebu President and Liloan Mayor Cristina Frasco said Marcos' track record proved him to be Moreno, who is also